My name is Sione Ofa. I'm a volunteer here at Good Samaritan Regional Medical Center here in Corvallis, Oregon. I have been a volunteer here ever since the end of November of 2016, so roughly coming on to about 5 months. It is most definitely commonly known as the pink cart because it is a bright pink. You see it, you hear it coming, so it's impossible to miss. But patients and nurses and doctors know it definitely as the pink cart. What I do is I'll push it around each floor, so I have access to the second and the third floor here at Good Sam, and I'll go and I'll look at a patient's chart and I'll see, which patient needs a one-to-one. And so if I get a patient that needs a one-to-one, I'll go first talk to the nurse, get any information about this patient so I can be aware of what I can ask to offer off the activity cart or what I should stay away from. And so most of the time, the patients can get anything off the activity cart. And so when I go into the room, I'll introduce myself, I'll talk to the patient, have a quick little conversation with them so that, everything isn't so awkward at first. And so then I'll ask them, would they like something off the activity cart to help them, keep themselves occupied, not bored or anything. And if they want something, then I'll read them the list. We have deck of cards, we got checkers, we have these little squeeze heart things, we have TheraBands, we have a lot of Sudoku, crossword puzzles, word finds. The thing they like the most is being able to have an interaction. An interaction outside of the typical, what is how are you feeling today? What is my diagnosis looking like? It's more so a very casual conversation, and sometimes patients will just love the interaction and they want, I've had numerous times where the patient will ask me to stay in the room just to play a game of checkers with them, play a game of cards with them. And it's those interactions that I enjoy the most, and I believe the patient enjoys a lot. That always makes me feel good because it makes me feel like I'm doing something different to help brighten their day. Just because being here in the hospital isn't the number one place that you want to be at. You don't want to be spending your days laying in a hospital bed all the time. And so being able to change up their mood to one more so positive aspect, it's always good with me.